Medical news from Lancet, London, England. Ralinepag for the treatment of pulmonary arterial hypertension, advance outcomes. A randomized, double-blind, placebo-controlled phase 3 study. Ralinepag, an oral prostacyclin IP receptor agonist taken once daily, cut the risk of clinical worsening by more than half in patients with pulmonary arterial hypertension, PAH, receiving modern background therapy, offering a new oral option for a disease traditionally managed with parenteral or inhaled agents. The benefit came at the cost of a higher rate of treatment-related discontinuations, underscoring the need to balance efficacy with tolerability when integrating Ralinepag into PAH regimens. PAH remains a rare but lethal condition, driven by progressive narrowing of the pulmonary vasculature that raises pulmonary vascular resistance, strains the right ventricle, and ultimately leads to premature death. Although current guidelines endorse combination therapy, including endothelin receptor antagonists, phosphodiesterase 5 inhibitors, and, when needed, prostacyclin analogs, the oral prostacyclin pathway has been underexplored, leaving a therapeutic gap for patients who cannot tolerate or access parenteral formulations. Ralinepag was developed to fill this void, but robust phase 3 evidence of its impact on hard clinical outcomes was lacking. Advance Outcomes was a multi-center, event-driven, phase 3 trial that randomized adult patients with hemodynamically confirmed PAH, mean pulmonary artery pressure greater than 20 millimeters of mercury, pulmonary artery wedge pressure less than or equal to 15 millimeters of mercury, pulmonary vascular resistance 2 Wood units, in a 1-to-1 ratio to Ralinepag or matching placebo. After a 50 g daily start, doses were titrated weekly to the highest tolerated level, with stratification by baseline 6-minute walk distance, etiology, and oral background therapy. The study blinded participants, investigators, and sponsor staff, and employed block randomization of 4 within each stratification stratum. Of the 728 patients who received at least one dose, 687, 350 Ralinepag, 337 placebo, comprised the full analysis and safety populations after excluding 41 participants from Chinese sites for regulatory and data integrity reasons. The primary endpoint was time to first clinical worsening event, a composite of all-cause death, PAH-related hospitalization, initiation of parenteral or inhaled prostacyclin therapy, disease progression, or unsatisfactory long-term response. Median follow-up spanned roughly 85 weeks for Ralinepag and 78 weeks for placebo. During follow-up, 64 patients, 18%, on Ralinepag experienced a first clinical worsening event versus 121 patients, 36%, on placebo, yielding a hazard ratio of 0.45, 95% CI 0.330.62, p less than 0.0001. The most pronounced absolute differences were seen in disease progression, the need for parenteral or inhaled prostacyclin agents, and unsatisfactory long-term clinical response. Serious adverse events occurred at comparable rates, 28% Ralinepag versus 31% placebo, and deaths attributed to adverse events were identical, 4% in each arm. However, discontinuation due to adverse events was markedly higher with Ralinepag, 19% versus 3%. Subgroup analyses hinted that the benefit persisted across the spectrum of PAH etiologies and irrespective of baseline functional capacity, although the trial was not powered to detect differential effects in specific subpopulations. Patients already on dual oral therapy derived similar relative risk reductions, suggesting that Ralinepag adds value on top of contemporary combination regimens. These findings position Ralinepag as a viable oral prostacyclin pathway agent that can have the risk of clinical deterioration in PAH, potentially reshaping treatment algorithms that have long relied on intravenous or inhaled prostacyclin delivery for high-risk patients. Guideline committees may consider endorsing Ralinepag as a first-line oral prostacyclin option, especially for patients who are unsuitable for parenteral therapy, while emphasizing vigilant monitoring for tolerability issues that could precipitate early discontinuation. The trial's limitations include the exclusion of a subset of Chinese participants, which may affect generalizability to Asian populations, and the reliance on a composite primary endpoint that, while clinically meaningful, combines events of varying severity. Additionally, the higher discontinuation rate raises questions about long-term adherence and real-world effectiveness, warranting further post-marketing surveillance and head-to-head comparisons with existing prostacyclin agents. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.